Hi guys, Kane Harrison here. Welcome to Nashville's Health and Wellness program. I am delighted to be joined by Dr. Ming Wang today. Welcome, Dr. Wang.
Thank you, Kane.
First, I want to say congratulations on Nashvillian of the Year. What an incredible honor.
Thank you.
Now, we've heard a lot about the third wave that is going to affect society, but you're going to teach us a little bit about the fifth wave today.
That's right. And it's interesting that, Alvin Toffler's classical book, The Third Wave, really revolutionized our thinking. It was a book that forecasted what was to come. And the first wave being agricultural revolution in human society, and second wave being the industrial revolution with the Carter's engine in 1840s or so. And Alvin Toffler wrote a book called The Third Wave because he forecasted the arrival of the third revolution, which is the informational revolution. So in medicine, in eye care, in eye surgery, we also have these kind of trends of waves, the procedure come that really change the way people live. And the first wave being phaco emulsification or cataract surgery, started in 1967. In 1974, we had the second wave, RK, radiokeratotomy, and for correction of nearsightedness. And then in 1991, we had the third wave, which is LASIK surgery to correct your prescription. And in 1997, we have the fourth wave with the premium lenses, the advanced lens implantation. So really around year 2010 or so, which is a few years ago, the fifth wave has arrived, which is the surgical correction of presbyopia, or what we call short-arm syndrome, the age-related loss of near vision. And there's going to be growing number of participants, players in this fifth wave. And but principal two players at this time is camera procedure and refractive lens exchange, for which we have published the world's first and only textbook so far, or 3D forever young lens surgery. We call that in our clinic. So as a human conditions, these previous four waves, phaco emulsification cataract surgery, radiokeratotomy, RK, LASIK surgery, and premium lenses, all of them correcting three out of the four human conditions, vision, nearsightedness, farsightedness, astigmatism. But it is the last condition, the holy grail of ophthalmology, the last frontier of vision surgery, which up until now there's no good surgical treatment. And that we have now the fifth wave. Fifth wave is defined as surgical correction of presbyopia, the last frontier in eye surgery.
Now, you are always on the cutting edge of technology and often inventing a lot of this stuff yourself. I see you've got a book right here, which is Refractive Lens Exchange, which I believe is the first and only, I think, book that has been written so far, of which you were a big part of. Just explain Refractive Lens Exchange a little bit, because I know that is in the fifth wave.
Yes. Regarding the composition of the fifth wave, which I truly believe will change the way we live. If anybody think, LASIK surgery have changed the way people live, but even after being around for 25 years, LASIK surgery, in the United States, it's about 10 million or so patients who have LASIK surgery. But the fifth wave, the number 5, surgical correction of presbyopia or old eyes, will affect everybody. Once you get over it, age 45 or so, one will be affected by what we call the short-arm syndrome.
Sure.
And so the scale, the impact, the number of people that is going to be affected, and the effect upon society, the way we live, is going to be unprecedented. So I believe this fifth wave is going to be the biggest compared with all previous four waves. And in terms of composition of the fifth wave, there are principally at the moment 2 surgical procedures. There will be more adding to the fifth wave, which is defined as the surgical correction of presbyopia. One is refractive lens exchange or forever young lens surgery in our clinic. That is to replace the aging lens with a lens that doesn't age. So not only we're rewinding the clock, we're actually stopping the clock. And you're right, this is the world's first and the only textbook ever published so far about the refractive lens exchange or forever young lens surgery. And the second procedure that consisting of the current fifth wave is camera, which is a procedure that approved by US FDA about a year ago, using the principle of pinhole to enable one to be able to focus up close once again. So the fifth wave consists of, at the moment, camera to reduce the reading glasses need, and refractive lens exchange or 3D forever lens surgery to improve distance and near vision.
And the refractive lens exchange really is extraordinary. I know you say it stops the clock, but one thing people don't realize, once you have this, no need for cataract surgery ever.
Yes.
Which is incredible.
Yes, it corrects nearsightedness, farsightedness, astigmatism, reduce your dependence on distance glasses, reduce your dependence on reading glasses, but also prevent cataract. And for the longest time we thought there will never be a procedure can actually prevent cataract. Yes, we do. Refractive lens exchange or 3D forever lens surgery in our clinic that can actually prevent the formation of future cataract. So it's a procedure that rewind the clock, actually stop the clock. It's interesting that rest of our body may get older, but not your eyes, you know. And very often patients ask questions, say, well, that sounds a little bit too good to be true. What's the catch? And there are two catches. One is a 99, majority of surgeons are not performing this procedure yet. They may dabble a little bit, but by and large, they don't specialize in that. There are a very small number of surgeons in the United States today who specialize in refractive lens exchange or 3D forever lens surgery. And we happen to be one of them. And we published the textbook, the world's first textbook on the technique, and we've been involved in lots of research development to improve the technology and in teaching surgeons. And I believe refractive lens exchange today in year 2016 is where LASIK surgery was in 1996. Anybody in 1996, when they first heard about LASIK, if they say, oh, that will never take off, nobody wants to have surgery to get rid of, glasses, they've proven to be wrong. It's a very popular procedure and really changed the way people live. But I think refractive lens exchange or 3D forever lens surgery, part of the fifth wave, will only be bigger and more impactful than LASIK.
And it's such a fantastic answer. We, obviously you and I have proximity to a lot of your patients, and we do see a lot of the baby boomers coming in to get this, and it's really a great time for them to come in between the ages of perhaps 55, 65, and have this amazing eyesight instead of waiting and being 85 and having trouble with cataracts and things like that.
Yes, yes. The medicines are changing. When I faced with a 52-year-old, I always say, well, you have the choice to have refractive lens exchange or 3D forever lens surgery, or you could wait until 82. But the thing is, from 52 to 82, there's a certainty, not a probability, a certainty of visual deterioration and increasing frustration. So, that's 30 years of your life. That's important, the quality of the life. So rather than experiencing that certainty of visual deterioration and increasing frustration, why don't we bypass that altogether? That's enhance our lives in the next 30 years, from 52 to 82, and using a procedure that fixes the problem once and for all. Rewind the clock and stop the clock. As I said, the rest of your body may get older, but not your eyes. The focal point that's so restored with this procedure no longer goes away again. And also, I always tell patients that, these technologies like Mercedes-Benz, you get a great car and great technology. So the question whether one should have 3D forever lens surgery or refractive lens exchange at age 52, or wait until 82, have medical cataract surgery, then have the forever lens implanted. Asking that question is like asking, if you're going to get a Mercedes-Benz, do you want to get it at age 52, or you want to get it at the age 82? So medicine has got to a point that we want to improve the quality of our life now, rather than suffering all these decades to come and then have perfect vision, have a surgery at perfect vision at age 95. What's the point?
That's right. Yeah. Now I'm 38. Everyone has said to me, when you get to 40, it's overnight and your eyes will start to change. And of course, I will start to get short arm syndrome. Switching a little bit to camera inlay, this is an incredible procedure because it's minimally invasive, it's done in one eye, it's done in as little as 15 minutes, and it can really be a game changer for people who are wearing glasses, who feel that putting glasses on their face makes them look 10 years older.
That's right. And the camera is very complementary to refractive lens exchange or 3D foveal surgery. And typically, you're absolutely right. At age 40 or so, our eyes start getting aging, and so it's coming for you a couple of years. And you will notice you have to push things further to read. So what we look at is we evaluate these patients first with the camera procedure. Through small pinhole effect, it can actually bring your focal point back. And some patients say, well, could I have LASIK surgery to improve that? Well, LASIK surgery, you can, in some cases, improve your reading, but you have to do what we call mono vision, one eye distance, one eye near, and some patients may not like it. But camera is the latest technology, and it can actually improve your reading without compromising distance. So we look at the camera, 45 or so or older, and then 3D foveal lens surgery or refractive lens exchange, 50 or older. And actually, as I said, FDA just approved the camera procedure last year, and we at the Wang Vision Institute was the first in the state to perform camera. It was one of the first in the country also. So we're one of the leading centers in this part of the country in performing camera procedure, in offering that to our baby boomers. So basically start 45 or older and 50 or older, so all the way until about 60 or 70 or 75, that we have a solution for this group of baby boomers who up until now have been left on the sidelines. You know, they're a little bit too old for LASIK surgery. They have not just distance vision, which is the what LASIK correct, but also they have the near vision problem, but also they're a little bit too young for cataract surgery. They're not quite 70 or 75 yet. So now we have a solution for our baby boomers. But most beautiful part is if you have either of these procedures, the effect is long-lasting. If you say have camera procedure at age 45, you implant it in, improve your reading. Later on, you could develop cataract, you have cataract surgery, but the camera stay in. The effect, the reading benefit, the ability to read without reading glasses, even after cataract surgery, if you have your camera implanted in early, will last for the rest of your life. You will be able to read without reading glasses even after cataract surgery, as long as you have this magical pinhole in. So the effect is lifelong. And similarly, refractive lens exchange or 3D foveal lens surgery, the other parts of the fifth wave, also effect is long-lasting because it basically prevents the formation of cataract, something that we thought up until now there's no way to prevent. And as I mentioned, the two catches for foveal lens surgery is one, you need to find the right surgeon. Most of the doctors are still learning, and the educational process for the surgeons are only in the beginning. That's why the book that I published is still the first and only textbook for 3D foveal lens surgery or refractive lens exchange. But I think times have come that the doctors will start performing it. But second catch is not everyone's a candidate. I always tell patients that go through a complete evaluation. I'm sure there are viewers out there that are thinking about it. Say, oh, I like to get rid of my reading glasses and distance. I like to treat my short arm syndrome. I'm 52 years old, but I don't know if you have kind of candidate. We always say, don't worry, come for evaluation. The principle is do it on when it's right. Many patients are not candidate either for camera or refractive lens exchange for these fifth waves, and our advice is don't do it. But yet, if you are a candidate, there's something to be celebrated because now you can have one procedure, either camera or refractive lens exchange. Its effect can be a lifelong lasting.
Now, there's a lot of people out there I know that haven't necessarily just developed eye problems when they hit 40. They've had problems for a long period of time. One of the questions we get asked a lot, if I've had LASIK, the third wave, can the fifth wave help me out now? Is there a possibility for me to come back to Dr. Wang or if you've come from someone else to get one of these procedures?
Absolutely.
Yeah.
Absolutely. Actually, I'm getting a whole wave of my patients who have had LASIK 15, 20 years ago when they were younger in their 20s and 30s. Now they are in their 40s and 50s or early 60s. They're coming back to have their eyes fixed again. I always tell them that we have done about 55,000 procedures, including on over 4,000 doctors. So many of these patients have LASIK surgery many years ago. They're coming back, and I tell them, this time, the effect of the treatment is permanent. If you have forever young lens surgery, for example, one of the fifth wave procedure or 3D forever young lens surgery, that you will be able to have your lens replaced, the aging problem of the lens corrected permanently. So they are not expected to having to need another procedure 20 years from now. So it's a permanent fix. And however, I always tell patients that it's important to do their homework, because in order to find a right surgeon who has to be able to be knowledgeable in every one of these previous 4 waves, from RK to cataract to LASIK to premium lenses. And only a surgeon who have knowledge and expertise, all these 4 waves, and then the surgeon is in a position to master this new technology and being able to offer a complete solution, incorporating the techniques of all 4 waves as clinical situation calls for. So in this case, the doctor needs to be expert in LASIK surgery, as well as in 3D forever young surgery or refractive lens exchange, or camera. One of the common questions I get from patients is, oh, Dr. Wang, so these are the technologies, fifth wave, camera, refractive lens exchange for baby boomers, short arm syndrome. But then, isn't it all doctors will perform with a similar quality? And since it's the same principle, the surgery, and I always say, playing golf is the same principle. Throw the round of the ball into the round of the hole. I would say, then same principle of the game. So I said, what's the big difference in playing golf between you and Tiger Woods, right?
Sure.
Like everything we do depends on how we do it. So all our patients listening to this program, viewing this, they still go back to the fundamentals. You have, not only we talk about technology, but technology can only produce the right effect. Get rid of your reading glasses, enjoying the fifth wave, only in the expert's hand.
Yeah, and I think there is a big why as well for you. We've talked about the technology, we've talked about your skill, but we haven't talked about the big man upstairs who you always gather in the room as well to say a prayer with your patients.
Yes, yes. I always feel that, doctors are very busy, rushing around, and no matter how smart you are, if you rush, you can make a mistake. And the vision of a patient is not something you want to make mistake with. So I pray with all my patients before surgery, because that slow me down to focus, double, triple check all the machine settings, focus on the patient and me, the surgery. And the second reason I pray is because it reminds me to be modest and humble. Because sometimes as human beings, when we get big-headed, that's where we can make mistake. So realizing that however much we have known as human beings, compare what he has known, God upstairs, is still very insignificant. So there's no reason to be pompous, big-headed. Focus on the basic, slow down, and be humble, and double, triple check everything. Even though it may be my 55,000th time, but it will be that patient's first and only time.
Absolutely. And speaking of being humble, we were lucky enough to be at an award ceremony recently for Dr. Ming Wang, who was given Nashvilleian of the Year, which is extraordinary. Talk about that a little bit. It must have been a fantastic honor.
Yes, especially, as an immigrant. I know that both you and me were immigrants, came to this country, start virtually with nothing. And, 1982, I started with $50 and came to this country knowing no one in this country. I was dropped out National Airport, Washington, D.C., with a Chinese-English dictionary, knowing no one, but with a big American dream to have come from that situation to be able to be in a position to make a worthwhile contribution to our society, And I believe this award by Kiwanis Club International, Nashvilleian of the Year, I believe it's the first time this award was awarded to an immigrant and minority. And I look at it as an award not just for myself, but for all immigrants, that all of us come to this country that feel that we have something to contribute. I always tell all my immigrants friends that to generate positive interaction between the natives and immigrants is not keep on arguing what you need to get, what should you give me and all that. But that's all together, work together, see what we can do, not what we can do for each other, but what we can do together for this country. You know, I feel very blessed to be in this greatest country on this planet. And as an immigrant, I have the obligation to pay back.
And I know it was fantastic for you. Your parents were able to be at the award ceremony. That's great. I mean, them watching you come all that way and then to be honoured like that, it must have been fantastic.
Yes, yes. My father, unfortunately, has Parkinson's, very, advanced. But to the little bit he could understand. I want him to be there because he works so hard to, for the family and help me escaping communist prosecution, Cultural Revolution as a teenager. When I was a teenager, 1974, losing all hope of education and future, and was facing the devastating fate of deportation. The communist government shut down all universities and deported all these youth. So he worked very, very hard, and now he is 84, and my mom 81. So in their sunset years, I feel that I want to, pay back to them as well. And so I recently, my wife and I decided a big decision. We moved both of my, elderly parents into our house and live with us every day. Yeah. And I think at their age, just to have their kids around is the biggest joy.
It's absolutely fantastic. Well, we've enjoyed having you on the program. You guys are going to hear more and more about refractive lens exchange, 3D Forever Young, and also 3D camera inlay. And when you do, remember that Dr. Wang was the first to do it in Tennessee and has been doing it for well over a year now for the camera and refractive lens exchange for many years. He's on the forefront of the technology and on the forefront of the fifth wave. We thank you so much. Thank you, Dr. Wang.
Thank you.
We'll see you next time.
Talkopolis, the social media TV network for your city.